Welcome back, you guys. We are on day number 27. Menopause Energized presents the 30-day Healthy Heart Marathon. Hey, you guys, this is Sheila. Welcome back, registered nurse and health coach with Menopause Energized. Guys, we are heading down to the finish line. We are on day number 27 of the Healthy Heart Marathon. Well, today we're going to talk about something a little different. If you are a woman over 40 and in menopause, there is a hidden risk quietly affecting your heart. And most women have no idea that it's even there. It's something you encounter every day, yet it rarely talked about, or it's rarely ever focused on. And ignoring it could be silently damaging your cardiovascular health. In this video, I am going to reveal what this secret is, how it connects to your heart health, and the simple steps you can take to protect your heart starting today. Even if you feel perfectly healthy, this hidden factor could be undermining your heart health right now. So don't go nowhere, stick around, because by the end of this video, you'll know exactly what to watch for and what you can do to keep your heart strong during your menopause journey. Okay, so we're going to go into what is this hidden risk? Well, it is poor oral hygiene. Yes, poor oral hygiene can affect your heart health. Poor oral hygiene can lead to, we already know this, gum disease and chronic oral infections. Bacteria from your gums can enter into the bloodstream and travel to the arteries of your heart. Bacteria triggers inflammation, which can accelerate plaque formation. Why is this important in menopause? Lower estrogen levels can reduce gum disease health with increased susceptibility to gum disease, which puts even a slightly higher risk of cardiovascular disease. Studies have shown women with gum disease have a 1.5 to 2 times risk of heart disease than women with healthy gums. Signs of inflammation, and I think we already know this as well. I'm just teaching you to stay focused. Bleeding gums when brushing or flossing. Persistent bad breath. Yes, that is definitely one. Swollen red or tender gums. Loose teeth or receding gums. And again, this is all from poor oral hygiene. So what can we do about this today? Up on here on the board, I have the menopause and heart health and dental. So some of these things we already know, ladies. I am here as a health coach with Menopause Energized. Some of these things you already know. Some of these things you may not know. My whole mission and goal of my program is to help women with their challenges through their menopause journey and to keep you more focused, because sometimes we know these things, but if we know what's actually may cause certain conditions or diseases or the danger, I can get you to focus on more of changing your lifestyle somewhat to prevent some of these conditionings from happening. Again, cardiovascular disease is the #1 killer in women, and our risk gets higher when we are in our menopause journey because of the estrogen levels. So some of this stuff, like I said, we know, but we need to focus and we need to take action, not just know it, because this is a serious risk. Daily oral care. You should be brushing your teeth. The American Dental Association now says that you don't need to brush your teeth after every meals now. If you want, that's fine. Twice a day is good. I mean, there's some people don't even eat 3 meals a day, and you drive yourself crazy if you eat a snack 4 or 5 times a day and go in the bathroom. So we'll cut that out. Twice a day is what the American Dental Association says that is good enough to brush your teeth. Once in the morning and once at night. Sometimes what we don't do, and I'm telling you, there is a difference. I practice this all the time. You're not just brushing your teeth, ladies. You are brushing your gums. You are brushing inside of your jaws. You are brushing all up and down here, all between your gums. So you're not just brushing the teeth. And I will tell you, that will cut down on bacteria in your mouth tremendously. And if you have that white coated tongue sometimes that you cannot seem to get rid of, have the daily practice of brushing your tongue. Floss daily. We already know this. I'm just trying to let you know what can happen when we don't start changing our lifestyle a little different and take action. We need to floss because the toothbrush cannot always get some of the particles that's stuck up in there. Think about it. If you eat popcorn or you eat stuff that get in between your teeth and you don't floss, and you should floss daily, you could go weeks if you don't floss, and that stuff, believe it or not, is still sitting up in between your gums, especially if you're one that has a lot of space between your teeth. You have more of a risk of stuff getting in between your gums than if they were pulled closer together. And as you know, as we get older, sometimes those teeth do spread and you have some space in between, and that's what puts us more at risk as well. So flossing will get that. You'll be surprised if you sit there and you let yourself go so long and you use that floss. You'll be surprised the stuff that you can get up that has been sitting up in between your teeth for weeks, maybe even months, if you don't floss daily. And then, of course, mouthwash. We already know this, but I'm just letting you know. These are the things you should be doing because some of this stuff, poor oral hygiene, can lead to more cardiovascular problems. So you definitely want to do the mouthwash to remove plaque and bacteria. Bacteria can be harmful, you guys. Absolutely. It don't just have to be about if you get the flu or if you get some more serious lung condition. But the flu is one of them. It just don't have to be the flu. Just bacteria growing in your mouth can be a huge problem. Reduce your sugar intake and your acidic foods because those alone will reduce bacteria growth. Bacteria grows on acidic area environment. So you want to cut back on that because not only that reduces bacteria, sugar intake and acidic foods causes enamel erosion. So it causes enamel erosion. So you want to try to, all this is about, I'm sorry to say, but this is what it is. We cannot live our life the way we used to. There has to be some changes. Now, there may be some people may have good genetics. I don't know, never had to change their lifestyle. But we do when we get in our menopausal years. If we have not by now, some of us already are doing well and have done all these things before, we need to change our lifestyle somewhat. Staying hydrated, you guys. Staying hydrated, I know it's a simple thing, but yes, staying hydrated, especially after you eat a meal. Some people don't like to drink water after meals, but when you eat and if you drink water after meals, I mean, it's common sense. It's going to, whatever you have stuck in between your teeth or in your mouth, in between your jaws, under your gums, it's going to wash some of that out. So it's a good idea to try to drink a glass of water after meals. And then, this is a controversy here. Replace toothbrush every 3 to 4 months. That's what they recommend. You replace it every 3 to 4 months, or if your bristles are looking worn out. You know how your bristles stay straight up? When they start looking like this, you want to change your toothbrush, and that may even be before the 3 months. So definitely change your toothbrush every 3 to 4 months. Also, after recovery of a cold or flu, there is not really no strict recommendation, and I'll tell you why in just a few minutes. It's just a precaution to change your toothbrush after a cold or flu, after you're in the recovery phase. The reason why we call this a precaution is because once you get the flu or cold or whatever you have, you can't reinfect yourself with the same virus that you already have. And that's why they say it's just a precaution. It's not something that's mandatory. Because think about it. If you sneeze and you have those germs, whatever you have from the flu, influenza we call it, and there's different types of influenza, but usually it's the influenza A, which is basically the flu. They test you for that, of course, in the hospital. And just imagine, if you sneeze, you got the bacteria in your hand, And just say you make a mistake and touch your mouth. You're not going to get the flu all over again. So that's the same scenario for the toothbrush. If you continue to use the toothbrush, you will not get that same bacteria to make you sick all over again and take you back to day one. But they just says, as a precaution, yes, change your toothbrush after you recover. And another reason why I want to mention this, because sometimes we be sitting there thinking, well, when should I change it? 5 days after I have the flu, 6 days? It really kind of don't matter. Just change, recover, because like I said, you're not reinfecting yourself with the same virus. And then number 5, dental checkup. Not every year, every 6 months, we should be getting a dental checkup, getting our teeth clean. That way, all the bacteria that we cannot reach sometime and clean our teeth, they can. Also, back to the flossing, a water pick is really good as well, because the floss will get what the toothbrush can't get sometimes, and the water pick will get what the regular flossing can't get sometimes. So yes, if you have a chance, it is good to own a water pick. And so I believe that is it. That's all I wanted to talk to you today, because we really don't focus enough on good oral hygiene. Yes, it can go to your heart. I've had patients when I was doing bedside nursing where they've developed abscesses of their tooth because of poor oral hygiene. And all I can tell you, and I don't want to go into a big thing, that they wind up in the intensive care unit. That's how bad it can be. So if you can see this down here, I'm not sure, this red part here, but I'm going to read it out to you anyway to end this video for today. Your mouth is not just about your smile or your teeth. Okay, maybe that didn't work so well. But it is about protecting your heart. So start today. And remember, I always like to end, take care of your heart. See you on day 28. Take care.